Hello, everyone, and thank you for joining us for today's webinar. 5 key metrics practices are focused in on 2023. My name is 𝗵𝗵𝗴𝗵𝗵𝗵, and joining me today is 𝗧𝗶𝗺𝗵𝗵. Thanks, Scott, for joining. How are you doing today?
Good. How are you, Nick?
Good, good. Excited about today's webinar.
Obviously, one of the biggest trends we're looking at is a decrease in Medicare reimbursement. Obviously, it wasn't as large as some were anticipating, but it's still something that we need to make sure we're accommodating for. And also looking at things like the labor shortage and other things that are really going on in healthcare. And one of the things that really came out of that webinar is the fact that we absolutely have to make sure that our organizations are being data-driven. We need to look at data along several different areas, ranging from our productivity to cost containment, looking at staffing issues, looking at other areas for improvement. And we need to make sure that our leadership has what they need in order to optimize operations. We need to make sure that all of that information and data is getting into the right hands.
Yep. And from that webinar and just us working with healthcare groups across the country, we were able to come up with 5 key metrics that we're seeing an increased focus on and we'll be discussing today. So why don't we jump right into it and talk about metric number 1, right? So metric number 1 is RVUs. Scott, RVUs are always important. Why is there an increased focus on RVUs this year in particular?
Yeah, obviously RVU productivity is something that we have to look at consistently throughout the year, regardless of the year, regardless of what's going on. Our productivity is really how we run our business. We need to make sure we're looking at all of the appropriate work RVU values, which is what most organizations are concerned with. But I think in a case where we're also looking at decreases in reimbursement, we need to make sure that we're also looking at total RVUs. And so we need to understand and look and see where do we think these will impact us, because while there has been a decrease in the conversion factor, there's been an increase in some of the ways that they've calculated the practice expense and malpractice components. We need to understand where we think we're going to be with regard to the changes in reimbursement and figure out, in order to meet our budgets, are we going to have to adjust any of our targets or budget figures we need to get to? Do we need to look at some benchmarking in order to really kind of drive the organization forward? And obviously, while we'd like to be able to drive this through an increase in a patient base and an increase in visits that are coming across, there are other ways that we can really hit our RVU targets, namely through revenue integrity and coding accuracy, making sure that we're doing everything we can to be as accurate as we possibly can in our coding and our charge entry, and then looking at wellness visits as well, and the utilization of those, because those can be increase in RVU productivity as well. So just that overall clinical fingerprint can get you there, even if you're not necessarily focused or have a lot of room for improvement for the number of visits that your providers are seeing. So let's take a look at a visualization out there that would help us get to something like this. Obviously, we said the first thing you need to know is, where do we stand in terms of the Medicare changes, or even if we have any other payer reimbursement changes that may be hitched on to that. And the way we can look at it is obviously something where we can dig down, we can look division by division, even provider by provider, and understand, what the components are of each, so that we can say, this is where we were anticipated to be, and here's where we think the changes are going to leave us. And that's going to let us know exactly what changes we need to make in our productivity in order to meet the goals that we've set.
Yeah, and what we're seeing, Scott, more so this year than ever, is communication, especially as it results from data, to key areas is so key. So, communicating to our providers, having a set of tools like that can easily make adjustments to benchmarks and targets when things like the Medicare changes come up, or other key industry changes come up, is really crucial this year. Using a dashboard like this that can showcase to providers their individual metrics and how they compare to the rest of their group in a clear way, so they can better self-manage, is so imperative.
Yeah, and when we talk about communicating with the providers, this is excellent. I think for management, we may even want to go a step further and make sure that they have visualizations available to help them focus where they don't necessarily want to be able to or have to meet with all of the providers. They may just want to look at the lowest 10-20% of the providers that are out there and work individually with them on different areas. Again, it may not necessarily be visit related. It may be something that is coding related. It may be charge lag created where, you know, if they got their charges in faster, that would increase the productivity numbers as well. And then we can understand how that's feeding into other important metrics as well. So being able to communicate with our executives and helping our executives know where they can focus their efforts can be a key when working with this as well.
Yeah, great point, Scott. So, you know, once we have our productivity under control, and another area we're going to want to look into is containing costs. And this brings us to our second metric of the 5 metrics practices are focused on in 2023, contribution margin. Now, I know this can be difficult, right? Because increased costs are often just a byproduct of increased visits and productivity. So, Scott, what angle do you recommend, you know, we look at this from?
Yeah, so obviously when we're talking contribution margin, we're talking revenues minus allocated expenses. And so I think if we want to really get into it, what we want to do is start looking beyond the financial statements that we can get out of the systems. We may want to start looking at even more granular levels. If we want to run P&Ls at a provider level or maybe even lower than that. But then that always leads into a question of how do we attribute those expenses to get them to where they go, because there's a lot that are fixed, there's a lot that are marginal, there's a lot that are shared. So looking at those from a couple of different ways, understanding staffing ratios, making sure those are where we need them to be, and then also overall operational efficiency. We talked about that at the very beginning, but looking at things that may not even necessarily be on the clinical side, but on the administrative side to make sure we're being as efficient as possible to be able to meet the needs of the productivity that's required. So again, you know, if this is something we're going to do, we probably want to be able to communicate with our providers how to get to what we want. And so this is something that we could show to a provider where we run a quick contribution margin. And this is a place where we've allocated expenses at an RVU level and look at the contribution margin by work RVU in this case. And this is something that can help physicians really better understand what they're doing, where the expenses are going.
Yeah, and that's really great to see that. But I think we could take it a step further, Scott, and look at how, you know, modeled data, you know, data that's more interactive can help give us a deeper understanding of, you know, costs and any other key metrics for that area or for that matter, right?
Yeah, well, I mean, this is a case too where, you know, what the providers need may not necessarily be what the administrators need or what the executives need. And so if you can create something like this for the administrative team, which allows them to apply filters pretty quickly and easily, but also look at then, you know, right away in that heat map, what are the highest contributors to the contribution margin or to the net income that's out there? What are places where there are outliers? What do we need to focus our efforts on in order to really find containment opportunities that are out there? Because obviously staffing is the largest one, but that may not be the best place to look. We're looking for efficiency. We're not looking for overall numbers at the expense of everything else.
Right. And it's always a fun conversation in organizations, you know, when they're trying to determine how to allocate costs. So, Scott, I know you work with a lot of our clients and customers. You know, what do you usually see in that case?
Yeah, so the allocation methodologies, you're right, those can lead to some fun conversations sometimes. But a lot of times what people just end up doing, and it's for an ease of reporting because the data is relevant or, you know, readily available for them to utilize, is looking at cost as a function of RVU, where you simply take your total cost, divide by your total RVUs, and you come up with an expense per RVU metric. And this can be really valuable, not just in allocating costs at kind of a provider level, clinic level, location level, whatever, but you can also look at it at a procedure level. And this is something that can be really helpful when you're analyzing contracts and reimbursement and looking strategically at your organization of, are there some services that we're providing that are not at all profitable or very marginally profitable, and something that we either need to address from a reimbursement standpoint or look at strategically within our group. Another way that groups tend to look at this is by visit. And sometimes visits is better because it makes it so that your higher performing providers aren't necessarily feel like they're being punished for being higher performers, that more expenses are being sent their way when really most of the costs are fixed and shared within the same location. So looking at it by visit can be a better way to look at it in those scenarios. And what we're looking at more here is that patient contact takes precedence over any sort of productivity that's being run, where we're looking at it from the patient standpoint, which is also a very effective way to look at it. It's really an organizational culture type thing, and organizational goal type thing to attach these expenses to what they find most important and maybe what they have particular initiatives around as well.
Yeah, I can really see why, contribution margins are so important this year in particular. And Scott, you kind of alluded to this, but when managing costs, it's really difficult to look at salaries because of what we're facing in the industry with turnover, right? And this actually brings us to our third metric practices are focused on this year, which is staff turnover rate. Now, I have colleagues in all kinds of different industries, banking, construction, healthcare. And this is something that everyone seems to be grappling with. The amount of times I've heard it's so hard to find good help or to keep our workers is astounding. With so many people changing jobs, Scott, what do we do as healthcare organizations to manage this more effectively?
Well, obviously, there are a number of different metrics that we can look at from the staffing front, but a lot of times people right now are looking at turnover because of the expense that it brings into play. Staff turnover rate can be way more expensive than just overall salaries when it comes into play if you have high levels of turnover. And so you really need to start looking at that. And here's the thing about staffing and staff costs, is that our staffing really needs to be optimized for the level of productivity that we need. So again, we're looking for efficiencies, not necessarily reduction. If we're looking for increases in productivity, we need to make sure that we have staffing that can accommodate that. Otherwise, it's going to lead to patient dissatisfaction. But there's a labor shortage, and healthcare has certainly not been immune to that as well. And what that labor shortage means is that there are other opportunities out there for our employees to go if they're not feeling engaged or satisfied with what they're trying to do. So we need to make sure that we have high levels of employee engagement that goes that way. And then, of course, understanding the expenses that come from staff turnover, where we may have, recruitment expenses, we have new hire bonuses, we have just the cost of placing ads and things like that. It can really get out of hand if we have high rates. So we need to look there. We need to look at disciplinary activities and really understand where our costs can best be contained in these areas.
Yeah, and that actually reminds me of an article I saw recently that referenced the study done through the VA. So in the study, they were initially encouraged to stop looking at their patient experience data and instead focus on their employee data and employee engagement. And what they found was that the higher employee engagement directly correlated with higher patient satisfaction, things like lower nurse turnover and, even increased performance in their call centers. It was really interesting, actually.
Yeah, no, this is definitely something that we've seen as the case out there, that, if you want to have, good patient experience, then having good employees is out there, because we find more and more with our patient experience that customer service is the one thing that drives those scores more than anything else. And so having active and engaged employees is definitely a huge thing. So obviously when we start looking at, there are a few different metrics that you can look at around staffing, and you can run some, simple and easy dashboards that look like this, looking at cost management, looking at obvious staffing, productivity levels. But ideally, at the end of the day, where you really want to be focused in during this time is with your turnover rates, and making sure that you're doing everything that you can to keep those as low as possible, and understanding the costs that are associated with that in order to get those levels to where you need them to be.
Yep. And, of course, happy and engaged employees, translates into happy patients. And that actually brings us to our fourth metric that practices are focused on this year, which is patient satisfaction. Now, and Scott, I have the opportunity to attend a lot of conferences, and it seems like this is, an area that seems to be a highlight that a lot of people have been talking about for the past year or two.
Yeah, in fact, we're being asked to speak more and more on this. We're giving a talk at the MGMA conference in March. I think you're going out to Kentucky to do one in March as well. So this is definitely, very much the trend of the period. And there's a lot of places you can look for patient satisfaction as well, but obviously the one we like to look at right now is, would they recommend the provider? Would they recommend the practice? And the reason we want to focus in on those two things is because that kind of gives an overall level of satisfaction where they say, would I recommend this to someone that I know and who trusts me to give a good recommendation? So that shows what they think of the practice if they're willing to give that recommendation there. So again, how do we get into this and where are we measuring? Obviously, you can look at the clinical survey scores that you're getting, and that has that direct question. So you can kind of dig in there. But in addition to that, I highly recommend everybody look at their online reviews. And the reason I recommend you look at your online reviews is because your prospective patients are looking at your online reviews. And those are becoming ever more critical with regard to how patients are choosing providers now. You may want to start looking at things from an overall provider versus care team split, understanding what's really driving that satisfaction, understanding that, again, customer service is the key driver. Also looking at things like access and how it's impacting, the ability to get in to see a provider and how that impacts your overall satisfaction scores. And read the comments. Look at what people are saying specifically, and then really focus in on that would recommend. And so the way we really recommend doing something like this is really digging down through a visualization tool that can help you really better understand what's going on. Again, you can apply filters, you can look at your lowest performers in a certain area or with a certain survey, and you can just dig down and see what are my areas of concern, who are the providers that are leading the way with the dissatisfaction, and we can dig in and understand, is it with the care team, is it with the provider, is it more a different area or score or section of patient access? So we can start looking not even at this higher level, but get down one more level and start looking at individual questions that are out there. And we can say, is this something that is access related? Is it something that's cleanliness and safety related or care team related? And really start looking at individual questions that come through on our surveys and saying, this is bad. These are areas that we absolutely need to address in order to improve our overall patient experience.
Yeah, absolutely. And, Scott, I really like that visualization from a management perspective, but, it's important to get granular with these kinds of KPIs, even down to the provider level. It's important to communicate these things to our doctors so they're aware where they stand and can adjust the way they treat patients accordingly, right? We can even do this, across our team scores. Again, it's all about communicating to our staff so they can better self-manage.
Yeah, and I think looking at something like this helps you to really dig in and understand too, provider versus care team, looking at individual areas that need to be worked on and areas where they seem to be performing well, and helping to, move that improvement forward that way. This is a good communication tool that can be utilized out there.
Mm-hmm. And of course, a big part of improving the patient experience is just being more proactive in patient care. And that actually brings us to our fifth metric, proactive care for high-risk patients. And, we've seen a lot more focus from organizations looking into more proactive care, especially as it relates to high-risk patients. Of course, not only is this good from a quality standpoint and patient satisfaction standpoint, but when we do it properly, it can also have, positive financial benefits to the organization.
Yeah, so specifically what we want to look at is we want to understand what percentage of our high-risk patients have their visits every quarter. or every month, or whatever level they need to get it at, and what percentage are getting wellness visits throughout the year. And so a lot of times the question comes up, well, what can we do to determine who's a high-risk patient? And I think there's a good readily available tool out there that comes from CMS, which is just utilizing HCC risk scoring. I know this is something that was set up for value-based care, but it's a really good way to stratify your population if you're doing it for everybody, and really understanding, again, where those highest level risk patients are. Because when we're being proactive, we're decreasing the urgency of care. When we're focusing on wellness rather than sickness, then we can call up a patient and say, hey, you haven't been in a while, can we see you in 2 weeks? Can we see you in 3 weeks? And not only are they not upset about that, they feel good about it because we're reaching out to them, they feel like we care about them, etc. On the other hand, if we wait until they get sick and we tell them, and they call us to get an appointment and we say we can get you in 2 to 3 weeks, that's a huge dissatisfier. So we're kind of taking control of our own patient access by being a little bit more proactive. And again, overall, this is going to improve our outcomes. By being focused on wellness, it's going to improve the patient experience and how well they're feeling. And then it's an opportunity to improve the overall bottom line as well when we're doing the right thing by these patients.
Yeah, I know this is something that, we've certainly talked about a lot in the past, and in fact, we've done another webinar on it for those interested in it. Certainly encourage you to go on our YouTube channel and watch that. Scott, I also know you recently did a YouTube presentation on a visualization we're showing today. When we talked about the importance of scoring all our patients, right, to give providers an indication of, how well they've done on getting their patients in. And, through the use of visual tools, we can get a lot better at showcasing these kinds of relationships and data that ultimately drive better care and bottom line revenue for our organization.
Yeah, and again, this is a good way to track where we are throughout the year, how well a provider is doing at getting patients in, getting them scored, getting them, understanding the risk levels that are out there. But if you have a good set of visual tools as well, that can actually help create work lists for you. It gives you a way to directly identify who are your highest and moderate risk patients that are out there. And then you can see who's past due for an appointment, who has an appointment already scheduled that maybe we need to, or who doesn't have one scheduled. And we can reach out and see if we can get them in within a time that's, relatively convenient for the provider's schedule, and also working with their schedule as well, where we don't have that urgency in place. So looking at a work list like this is really something that can be done fairly quickly and easily with the right set of tools and the right data in front of you. So I think a way that we can measure as well how we can be more proactive is, another dashboard that we looked at for appointment sources. And this is something that we've also utilized as the PDS dashboard of the month, where we can look and see, are our patient access or patient appointments being driven by the patients, the ones that the patients are requesting through inbound calls, through the patient portal, etc., or is it something where we're being more proactive, where maybe we're reaching out and calling them, or we're getting them while they're in the clinic to schedule up their follow-up care. Like my dentist, they haven't even taken the picks out of my mouth before they're scheduling my next 6-month cleaning. So things like that can really be, help our practice be a little bit more proactive and have a little bit more control that way. And we can start looking at trends through, some dashboard like this that really helps communicate out how well we're doing with the goals that we've set.
I gotta say, from a visual standpoint, that's probably one of my favorite visualizations in this entire presentation. I love that one. So
it's very pleasing. The pastel. Yeah.
Something like that. Yeah. So of course, today we talked about the 5 metrics and trends in 2023 that practices are focused on. And in order to do these 5 metrics, you need to be what we call data driven, and that's still a key trend. So let's take a second here and talk about, what does being data-driven really mean?
Yeah, so when I work with a client and we're trying to get them to establish a more data-driven culture in their practice, what we're trying to do is to try to remove biases that are just kind of out there based upon just individual perceptions, and focus on the data. What is the data telling us, and saying that's the truth? That's what's really going on. And so we're trying to focus on continually using the data that way to look at opportunities that are out there, to look at areas of low performance and saying that's not an area where we're struggling, that's an area where we have a huge opportunity, almost always leading to a bottom line revenue driver. And then in addition to that, we can take those opportunities and we can find some insights that are coming that can help us to really improve performance everywhere. So it's utilizing data to make decisions rather than going from the gut or using internal biases or perceptions that may not have any basis in what the data is actually telling us. And really, in order to get there, what it requires is moving to a higher level of analytical intensity. We have to get past just data summaries, we have to get past just trend analysis, and we have to get into this higher level stuff.
Yeah, and of course, as I talk to more and more organizations, a lot of them are really trying to break into those higher analytical intensity type functions, right?
Yeah, no, definitely. And even as we talked today, we gave 5 metrics, but every one of those 5 had little sub metrics or ways that you can get there. And so, having that type of data at your fingertips so that you're not just looking at what, but you're looking at why. And in order to really seamlessly move between those, you want to have what we call the analytics trio. And that's where you have the visualization, like we showed for executive management and things like that. You have the slice and dice, where you move in and say, well, we see what's going on. Why is it going on? Where are our outliers? Where do we need to focus our attention? And then maybe you even need to get into detailed level reporting. And that can get really tricky if you're utilizing different tools for all of these functions that are out there, because you have to rerun the queries, you have to make sure the parameters match, and they may not even be hitting the same tables. And so it can be tricky if you're doing it from different tools in order to get to all 3 of these different levels.
Yeah. And it's common. I see a lot of organizations that aren't more data driven, and it's because they have very manual reporting process, and they often struggle to get to the reporting to the level they need it to be due to the manual nature of the reporting. So oftentimes it takes a lot of time to collect that data that they're trying to report on, and then they have to manually blend that and put it together, which is prone to errors, of course, very often. And once they have all their data and their KPIs lined up, they have to deliver the data to end users, which can be really difficult. So, and by the end of it, once they finish all that for the month, the reporting for the month, they need to start all over again for next month. So it's a very laborious process. So, and that's a big reason why we're seeing more and more organizations trying to move towards automation. Whether it's through internal tools they developed or through the use of tools like PDS Dash. And for those of you who don't know Dash or aren't familiar with PDS Dash, it's a productivity tool that helps blend those different data sets that we've looked at today together and automate the production of highly visual and graphical dashboards that can be easily distributed to different levels within the organization. Again, it's all about communicating to the folks who need that information so they can better manage.
Yeah, and again, communication is the key if we want to hit the goals that we're setting, and if we really want to focus on these key metrics. That's a tool that'll help us to blend all of the metrics in one place. So to bring back what we're talking about today, these 5 key metrics that are really the focus of a lot of practices this coming year, looking at RVU productivity, both work RVUs and total RVUs, understanding what levels of productivity we need to achieve in order to overcome any sort of reimbursement reductions that we're seeing. We need to look at cost containment and look at overall efficiencies rather than just trying to cut here and there. How can we be more efficient in what we're trying to do? Looking at staff turnover rates, making sure that our engagement is high enough that it's not driving a high level of turnover, because that's what can be exceedingly costly in our staffing budgets that are out there. We want to look at our patient experience, patient satisfaction, and particularly dig into that. Would they recommend us? And if not, we need to make sure we're looking at the comments and really digging in to find out what those dissatisfiers are so that we can correct them. And then, of course, we want to take care of our high and moderate risk patients, our frequent flyers, if you will, where we have plans in place where we can make sure that we're proactively managing them, that we're working with them more at a state of wellness than in a state of sickness, and really driving it that way, because that can impact really everything along the the spectrum of the overall patient experience and being patient focused within our practice.
As we wrap up, if anyone's struggling with anything we'd shown today or other areas you'd like to explore, we really love what we do and would love to talk to you and see if we can help or at least point you in the right direction. And of course, for more information, we always encourage folks to visit our website, find us on YouTube, or just reach out to us anytime. Again, we'd love just talking about this kind of stuff. So Scott, I did want to take a moment and say thank you for your time today, and really appreciate working with you here today. So it's been a pleasure.
Yeah, thank you. Thanks for being here, Nick.
And thanks to everyone who attended today. Have a great day, everyone.